Welcome back, everyone. Today, we'll get to the second part and learn about the etiology, risk factors, and pathophysiology of cancer. The etiology of cancer is yet unclear. Studies have shown that environmental factors have a large impact on the occurrence of malignant tumors. In addition, the internal factors of the body also play a major role in cancer. Let's start with the environmental factors. First, radiation. Long-term exposure to ionizing radiation without protective measures may lead to certain types of cancers, such as leukemia, lung cancer, skin cancer, etc. Excessive exposure to the ultraviolet radiation has long been associated with melanoma, squamous, and basal cell skin cancers. Secondly, many chemicals have been found to be related to cancers, such as alkylating agent, polycyclic aromatic hydrocarbons, nitrogen mustard, nitrosamines, and aflatoxin. Finally, biological factors, which mainly refer to carcinogenic viruses, as well as some kinds of bacteria and parasites, could also lead to cancers. For example, EB virus is associated with nasopharyngeal carcinoma. Human papillomavirus is associated with cervical cancer, and hepatitis B virus is associated with liver cancer. Some bacterial or parasitic infections may also lead to the occurrence of cancer. For instance, Helicobacter pylori is identified as a significant cause of gastric cancer, and Colonococcus sinensis is related to liver cancer. Now let's move on to internal factors, which include genetic, endocrine, and immune factors. Tumors have genetic predisposition, that is, genetic susceptibility. Those carrying certain genes are more susceptible. For instance, patients carrying the defective gene BRCA1 or BRCA2 are prone to breast cancer. Some hormones are related to cancers too. For example, estrogen is related to breast cancer and endometrial cancer, and androgen is related to prostate cancer. Lastly, people with congenital or acquired immune deficiency are prone to malignant tumors. Patients with acquired immune deficiency syndrome, AIDS, have an increased incidence of the capsicsarcoma and other cancers. In histological grading of tumors, the appearance of cells and degree of differentiation are evaluated pathologically. For many tumor types, 4 grades are used to evaluate abnormal cells based on the degree to which the cells resemble the tissue of origin. Tumors that are poorly differentiated, undifferentiated, have a poorer prognosis than those that are closer in appearance to the normal tissue of origin, well differentiated. Grade 1. Cells differ slightly from normal cells, mild dysplasia, and are well differentiated, low grade. Grade 2. Cells are more abnormal, moderate dysplasia, and moderately differentiated, intermediate grade. Grade 3. Cells are very abnormal, severe dysplasia, and poorly differentiated, high grade. Grade 4. Cells are immature, primitive, aneuploidy, and undifferentiated. Cells of origin is hard to determine, high grade. Malignant tumor cells can not only infiltrate and grow in the primary site, involving adjacent organs or tissues, but also spread to other parts of the body through a variety of ways, including lymphatic metastasis, hematogenous metastasis, and implant metastasis. Direct spread refers to the direct invasion of malignant tumor cells to adjacent tissues. In lymphatic metastasis, tumor cells invade the lymphatic vessels, arrive at the renal lymph nodes with lymph fluid, and finally enter the blood through thoracic ducts, resulting in hematological metastasis. This is a common way of tumor metastasis. After tumor cells invade the blood vessels, they can reach distant organs with blood flow, continue to grow, and form metastatic tumors. When malignant tumors that occur in organs in the body cavity, such as the chest and abdomen, invade the surface of organs, the tumor cells will fall off and grow in other organs in the body cavity, forming multiple metastatic tumors. This is defined as implantation metastasis. Finally, let's learn about the TNM classification system. We use it to determine the anatomic extent of the disease involvement based on 3 parameters: tumor size and invasiveness, T; presence or absence of regional spread to the lymph nodes, N; or metastasis to distant organ sites, M. According to different combinations of 3 indicators, we diagnose the cancer as stage 1, 2, 3, and 4. The specific criteria for TNM staging of various tumors are agreed by professional conferences. Okay, that's all for today, and I'll see you in the next session.